Hello and welcome back to my channel. I am Dr. Alex Popovich, breast surgeon and menopause specialist. And today I will be talking about a topic that affects every woman on this planet. And it also affects her husband, wife, partner, and children, as well as parents. And this is menopause. So what is actually menopause? Menopause is a natural stage in woman's life. There is nothing wrong about it. And it is when women's periods stop for good 12 months. It marks the end of the reproductive years. And what we often think about the menopause is it happens all of a sudden. But this is not really 100% true. The average year of menopause is around the age of 51, but it can happen anytime between 45 and 55. It a little bit depends on your family history, especially your sisters or your mums. And this transition happens because a woman's ovaries stop producing three hormones: estrogen, progesterone, and then testosterone. In medical school, we didn't really talk about effects that these hormones have on a whole body and on different systems like bones, heart, and brains are the most common. But it's every single cell in woman's body is affected by these three hormones. Menopause is once woman has stopped having periods for 12 months. Some books talk about postmenopause, but to me, that's not really the right term, because once woman has entered menopause, she's never out of it. Her hormones never come back. Some of the symptoms will get better, but some will never get better. And some risks will continue throughout woman's life while she is in menopause. 1 in 100 to 3 in 100 women experience premature menopause, which is under the age of 40, and a certain amount of women who experience menopause between the age of 40 and 45. So what actually happens during this times? So menopause symptoms can vary widely, and some women breeze through it, don't even have one symptom that they can say, I'm going to go into the menopause. And then some have really difficult symptoms to control during this time, change in periods. Some women go longer in between the cycles, between the time they bleed, and some get shorter. Duration of bleeding is same, some goes longer, some goes shorter. It possibly the first time the woman starts thinking something is happening to my body. The other symptoms that we always attribute to menopause is hot flushes, which can happen at any time. And they feel like there's this heat all of a sudden radiating their body, and then you just sweat. There is no control whatsoever over it. You may have sweats associated with these flushes, or you might just have this weird feelings. These can happen at night as well, where the women wake up during the night and have to change their bedding 3 or 4 times in the evening or during the night because they've sweated so much. The other common symptoms which affects women possibly the most is disturbances in sleep. Often it's not really going to sleep, even though some women get that, but it's actually waking up at around 3 o'clock in the morning and then not being able to go back to sleep, and then you just go back to sleep and then your alarm goes off. I struggled with this the most. The other symptoms that a lot of women have are the mood changes. So it's PMS on steroids. Some all of a sudden may notice anxiety and they've never had problems with anxiety, and some may have depression. The other common symptoms that affects women a lot is brain fog, where your brain just doesn't work. You can't find the words. And you know what you're going to say, but it doesn't come out, or it comes out completely and utterly weirdly. And it's scary because you start thinking, oh my God, I'm going to get Alzheimer's or dementia. There's something really wrong with me. And the other really common symptoms is joint pains and stiffness. For me, it was in the hands. I would come out of operating just one case in theater and feel I have to stretch my hands. I have to constantly be doing this to relieve some of these symptoms. Other symptoms of vaginal dryness, which can lead to discomfort and painful sex, bladder changes where women feel like they're getting UTIs almost all the time, or they wake up at night often having to go to toilet. There's a lot of body changes, thinning of the hair, dry skin, this weird itchy crawly skin, weight gain, heart palpitations, which is heart racing, dizziness, headaches, changes in the smell, bloating. We as women are used to hormonal changes. We get them before period and we start realizing, oh, I might be getting close to my period because I'm getting grumpy. Everything's irritating. If I was driving, everyone around me was such a bad driver and I was so irritated by everyone else's driving and not putting the indicators on. In menopause or perimenopause, you notice these things of grumpiness getting worse, but it's not just grumpiness. It's often anxiety where you wake up in the middle of the night and you're anxious, you can't go back to sleep, you don't know what's happening. Some women can get depression where they just feel more and more blue. If you are struggling, do remember there's a lot of women around who are struggling as well, and you're not alone. Talk to your friends because often they're going through the same changes. Talk to your family, talk to your husband or your partner, and talk to your doctor because we as doctors are here to help as well. Menopause affects women's risk at heart disease. Women at the age of 25, 30 is 5 times less likely to get a heart attack than a man of the same age. As they come to age 50, they're 2 to 3 times less likely, still much lower than men. And then all of a sudden they hit menopause, that rate of developing heart disease increases significantly. So by the time woman is around age of 65 to 70, her risk of heart disease is exactly the same as in men. Risk of osteoporosis increases significantly in the menopause, especially in slight, slim women. What you can do during this time with osteoporosis is weight-bearing exercises, so doing squats, putting a backpack with some weights in or some books in and going for a walk. Some women who don't drink or eat lots of dairy might need some calcium. And if you're not in lots of sunshine or using lots of sunblock, you might need some vitamin D. And at times you might need medication like bisphosphonate or HRT to help osteoporosis progressing or to prevent osteoporosis. This time in woman's life causes a lot of stress on the relationship. Part of it is because women during this time have often children who are going through high school or university and leave the family. They have older parents who they have to take care of. They're not sleeping well. They have more anxiety, develop a loss of libido or lower libido, vaginal dryness. The sex may not be as comfortable as they've had in the past, and they may avoid this, which can further cause the rift within the relationship. And this is one of the times then relationships are more common to fall apart and for women to get divorced or lose jobs because it's such a huge transition in their life. And it's really important that you talk to your partner during this transition time because they often want to help you as well, but they don't know how. So talking to them, telling them how you feel, what is going on, and getting some help from your health professionals is also a key as well. When it comes to this challenging time, there is no one size fit all. And this is where it's sometimes hard for us as a doctors, but also for patients, because we don't know what the right level for the woman is of her hormones. We know that lifestyle changes help, like exercises, healthy eating, stress reduction, yoga, trying to get good sleep, HRT is excellent when it comes to severe symptoms and also for bone protection and heart health. There are antidepressant medications that we sometimes use as a first-line treatment in women who cannot have, or we don't recommend HRT. Some natural supplements help, and they are definitely less effective than HRT. Always discuss with your doctor what is the right treatment for you. What would you like to start first, see how you go, and then tailor it according to your needs. A really important thing is for you to try and figure out what your symptoms are and have a symptoms diary to tell you what's happening. Because, as said, apart from symptoms, we as doctors don't have any guidance on how much hormones is enough for you. As said, every woman at some stage will go through menopause, but each journey is unique. Some women feel great, they don't have periods and they feel liberated, while others have significant number of symptoms and their quality of life significantly has deteriorated. The most important thing is for you to get to know more about menopause, about this time in life, about your symptoms and also your wishes, and talk openly to your friends and family. And this time is actually exciting time because through the right knowledge and the right care, we can all thrive in this time of our life. If you have found this video helpful, please subscribe and share. And also drop any questions or experiences that you have had in the comments below, because I'd love to hear them and we can talk more about it. And remember, you're not alone in this journey. Thank you very much for watching this video and take care of yourself and loved ones. Bye for now.